From warmth to worry, labor slammed for stripping support from the dying. Labor faces backlash over cuts to winter fuel payments for terminally ill Britons. The Labour government's recent decision to restrict access to the winter fuel payment has sparked widespread outrage, particularly from advocacy groups and political opponents, due to its devastating impact on vulnerable groups such as terminally ill individuals. The change, which involves means testing the benefit, is seen by many as a betrayal of some of the most vulnerable members of society during a time when energy costs are soaring and winter temperatures can pose serious health risks. The policy shift. Previously, the winter fuel payment was a universal benefit available to all pensioners, aimed at helping them afford heating during the colder months. However, under the new Labour policy, the payment will only be available to those who qualify for pension credit or other means-tested benefits. This change, while ostensibly designed to ensure that limited resources are directed towards those most in need, has led to the exclusion of thousands of individuals who are terminally ill but do not meet the strict eligibility criteria for means-tested benefits. The impact on terminally ill individuals. One of the groups hardest hit by this policy change is terminally ill individuals. Many people in this category face significant financial challenges due to medical expenses and reduced income, yet do not qualify for the means-tested benefits required to receive the winter fuel payment. Without this critical support, many terminally ill Britons will be forced to make harrowing choices between heating their homes and other essential needs such as medication, food, or transportation to medical appointments. For terminally ill patients, the ability to maintain a warm home environment is not just a matter of comfort but a necessity for health and well-being. Cold homes can exacerbate existing conditions, weaken immune. Advocacy groups warn that the exclusion of terminally ill individuals from this payment could lead to a significant deterioration in their quality of life and even premature deaths. Criticism from advocacy groups and political opponents. Critics have not held back in their condemnation of the policy. Advocacy organizations, including groups supporting the terminally ill, have described the decision as inhumane and short-sighted. Political opponents have also been vocal in their criticism, highlighting the moral and ethical implications of denying essential support to the most vulnerable. The backlash is fueled by evidence suggesting that cuts to such payments can have catastrophic consequences. Labour's own research in 2017 indicated that means testing the winter fuel payment could result in an additional 4,000 winter deaths among pensioners annually. Moreover, the Department for Work and Pensions has admitted that the policy could push up to 100,000 pensioners into poverty. The potential consequences for terminally ill individuals are particularly severe, as they are already among the most at-risk populations. The broader debate on resource allocation. The Labour government has defended its decision, arguing that the policy is a necessary measure to target resources more effectively at those in greatest need. According to officials, means testing ensures that taxpayers' money is spent on individuals who truly require financial assistance, rather than providing a blanket payment to all pensioners regardless of their circumstances. However, this argument has done little to quell public anger. Many argue that the cost savings achieved by this measure pale in comparison to the harm it will cause to vulnerable groups. Critics also point out that the administrative burden of means testing could offset much of the financial savings, raising questions about whether the policy is truly cost-effective. The broader context, rising energy costs and economic pressures. The timing of the policy change has further fueled the controversy. Energy costs in the UK have reached unprecedented levels, with many households struggling to afford basic heating. For those living on fixed incomes, such as pensioners and individuals with terminal illnesses, the situation is particularly dire. The winter fuel payment was seen as a lifeline for these groups, helping them navigate the financial challenges of the winter months. The decision to restrict access to this benefit has been described as particularly cruel in light of these economic pressures. Advocacy groups warn that the policy could exacerbate fuel poverty, leaving thousands of vulnerable households unable to afford adequate heating. This, in turn, could have a ripple effect on public health, increasing hospital admissions for conditions related to cold weather and placing additional strain on the already overstretched National Health Service, NHS. Calls for reconsideration. In light of the growing backlash, many are calling on the government to reconsider its decision. Advocacy groups and political opponents have urged Labour to restore universal access to the winter fuel payment or at least introduce exemptions for terminally ill individuals and other particularly vulnerable groups. They argue that the government has a moral obligation to protect those who are most at risk, especially during the winter months. The ethical and political implications. The controversy has also sparked a broader debate about the role of government in supporting vulnerable populations. Critics argue that the policy reflects a troubling shift away from universal benefits and towards a more selective approach to welfare, which risks leaving many in need without adequate support. The decision has also been framed as a political misstep for Labor, undermining the party's traditional reputation as a defender of the vulnerable and disadvantaged. As the winter months approach, the consequences of this policy change will likely become more apparent. For the thousands of terminally ill Britons who have lost access to the winter fuel payment, the stakes could not be higher. Whether the government will respond to the growing outcry and reconsider its decision remains to be seen. For now, the controversy serves as a stark reminder of the human cost of austerity measures and the importance of ensuring that social safety nets are truly inclusive.